So your first exercise will be whole body mobility, but focusing mostly on your thoracic spine. This is another way of saying your middle spine. A lot of lumbar spine pathologies actually happen because there's lack of mobility in your middle spine. So we'll go for that one first. So you'll start standing, you'll face one way with your right foot forward. I'm starting with my right foot forward, left foot back, arms in front of you. Take an inhale, you're going to rotate to the right. So this is the rotation. Thoracic spine likes to bend a little bit from side to side. So you'll hug your right rib cage with your left hand and lean towards the front. And the first one, we're just going to take one breath here. So take an inhale. Exhale, bring yourself back to center. It's nice to kind of repeat those movements. Second one, we'll stay for 2 breaths. Inhale, hug your right rib cage, lean, take an inhale. Exhale, this hand is helping you notice where you should be rotating and breathing for. Inhale, exhale, come back. And we'll just do it a third time. And then maybe the third time is more static. You kind of just lean into it and you stay however long you feel like you're getting some benefit. Breathing to your middle rib cage. Whoop. Great. And then come back. And for the second side, left foot forward, arms in front of you. Once again, inhale, open, rotate to your left this time. We're just doing it for 1 breath this time. Hug your left rib cage with your right hand. Lean towards the front. Take an inhale. Exhale, bring yourself back to center. I'm going to separate my feet a little bit wider. This will give you better balance that I'm noticing. Second one will stay for 2 breaths. So inhale, open. Hug your left rib cage. Lean forward, inhale. Again, this hand gives you an idea where you should be breathing for, expanding your rib cage. Take 1 more breath. Back. Third one is more static, so you decide how long you want to stay. Rotate, side bend to the front, and breathe. Moving your upper rib cage, your thoracic spine. And then when you've had enough, go ahead and come out. The second exercise is I'm using the Coregeous ball from Tuneup Fitness, but you can use a Pilates ball. And we'll be rolling our bellies just because even if you don't think about it, anything that's affecting your lower spine could have to do with either too much tension on your belly or maybe lack of strength, which we'll focus in one of the exercises. So when you're ready, grab your Pilates ball. You're going to be facing down and meet me on your mat. Okay, so there's different ways of doing this. We'll start by placing the ball under your right groin area, and you're going to be moving. So even if your mat is like this size and you don't mind being on the floor, and we're just gonna roll up towards our upper right rib cage. And you can just do this a few times. There's really no right or wrong way to do this, but it's just putting enough pressure so that you're actually massaging the layers of your abdominal walls. And then maybe you go across and then you go down. Will find different theories as to which is the right way to roll, whether you go from your right side down to your left side, or whether you should clear the left side, your descending colon. But we can talk about that in a different belly video. But for this one, just kind of massaging your belly, and you're used to using these balls. You can kind of do intuitive movement and go a little bit from side to side towards your waistband. If there's any areas where it feels really tender, I'm kind of coming off from my mat. That just happened naturally, but going a little bit higher. And then maybe if you know that your breathing is somewhat compromised, breathing is a huge factor in lumbar disc herniations or whole body imbalances. Maybe it's just resting over your diaphragm and closing your eyes and taking a breath. I'm obviously doing this a little bit faster just to show you the exercise, but if you want to take more time, go ahead and pause the video now before you go to the next exercise. But when you're done, you can just rest on your belly for a moment. If the ball is comfortable, maybe place it under your forehead and just stay here for a few breaths. Start by facing down. You're going to pull your legs away from your torso, and we'll start with the right leg. But before we do that, press your left foot down onto the floor. Have your left leg engaged. Lengthen your right leg away from you. Before you even lift, think about squeezing your right butt cheek so you're using the power of your glutes, and then from there lift up Take an inhale and exhale. We'll just do that 2 more times. So again, press that left foot down. Feel like your right leg is lifting up because you press your left foot down, squeeze your right butt cheek, and release. So the power is coming from your glutes and less from your lower spine. Last time, lift up and release. And we swap. Push that right foot down, engage that right foot down, squeeze your left butt cheek, and lift your left leg up. And release. Obviously, this is like a gentler version of cobra. Squeeze your left butt cheek, lift up and down. And then last one, push the right foot down, squeeze your left butt cheek, lift up and release. This next exercise is for SI mobility. Again, thinking further away from the lumbar spine, but addressing any pelvic imbalances. So you'll need a block for this one. You'll come to a tabletop position. Let's start by placing the left knee on top of the block. This is one of my favorite exercises to shear your SI. So as you press down onto your left knee, you're going to pull up with your right knee and the right side of your pelvis. So you're just coming up and down. Your SI actually doesn't have a lot of mobility. It just kind of has this sliding movement of your ilium over your sacrum. I'm going to do it wrong a few times just because it's not opening, and it's not kicking out. It's literally just pulling the right knee up. So your knees stay in one line. It's just going up and down. You can do this anywhere from 10 to 15 times. I'm going to show on the other side. So right knee, feel like the power is coming by pressing this right knee and right shin down. So I plug my right knee down so my left SI rises up, and then I come down and then up. If you want to move with breath, maybe inhale as your left knee comes up and exhale. And same thing, just repeat anywhere from 10 to 15 times. You can't think about the lower spine without addressing the core. So we'll do one exercise of many core exercises that you can do in this short video with the Coregeous ball, Pilates ball. You don't need it, but it is nice to have it. So go ahead and place the ball in between your knees and your thighs, lay on your mat, and even just laying here, engaging your legs can feel like you're doing a lot for your core. So if this is a lot, maybe just stay here, breathe to the sides of your rib cage. And if you want a little bit more, start to kind of windshield wipe your knees a little bit from side to side. Synchronizing your breath, so maybe it's an inhale as you go to one side, exhale, engage your core as you bring yourself back to center. And you don't have to go really low. In a moment, I'll tell you what I would like you to focus on. So when you roll onto one side, if you look down at your knees and you see like one knee is further behind than the other, that's the nice thing of having the ball. Try to bring that top knee so that it's in line with your bottom knee. And it doesn't matter if your shoulders lift up, and then exhale, bring yourself back to center. And then go ahead and go to the other side, and then same thing, try to match your knees. So it might require you to lift this right side a little bit higher. You'll feel the twist happening more in your thoracic spine, your middle spine, and then come back. And then obviously if you want to go a little bit further down, just match your knees. Again, it doesn't matter if your shoulders lift up. Exhale, bring yourself back to center and go to the other side. I wouldn't do this when you have an active flare up your lumbar spine. It's more for preventative and kind of rehab if you're trying to get your spine a little bit stronger.